we are so fortunate in Open to have access to just a treasure trove of committed experts at the national, state, and local policy levels who devote so much of their time, energy, and expertise to helping us as a network learn about current and upcoming policy opportunities or challenges and supporting the work that we are able to do in the advocacy space. So if you have listened to one of our bi-monthly network federal policy update calls or been on a call of our policy NRT, you have seen firsthand what this is about. And if you've taken part in any of our in-person or virtual advocacy, including last year's Hill Day and the Open's Virtual Day of Action back, I think it was the first week of September, then you've also had an opportunity to take part in that exciting work. So I am going to turn the microphone over now to Casey Wilson with the Dental Access Project at Community Catalyst, who is going to lead a panel discussion of ways that members can identify federal, state, and local policy agenda items in the coming months. And Casey, if you will start us off by reading and attesting to this declaration and then getting us started.
Sure. So I declare that neither I nor any member of my family have a financial arrangement or affiliation with any corporate organization offering financial support or grant monies for this continuing dental education program, nor do I have a financial interest in any commercial products or services I will discuss in this presentation. And that applies to me as well as all the panelists. So thanks, Stacy. And I'm really happy to be joined by several panelists today. We spent the last few days discussing the role of oral health in creating a more equitable society, and we've begun as a network to identify our long-term targets for leveraging change. One thing that I think is clear from many of the conversations we've had over this week is that achieving many of the targets we want to focus on will almost certainly require policy advocacy at the local, state, and national levels. And while we won't know for some weeks or maybe even a little bit longer exactly what the political and policy environment in 2021 and beyond will hold for us, we do have some immediate opportunities to lay the groundwork for our collective efforts, as well as prime our partners and policymakers to take action. And so as we approach what could be a very different policy landscape, we want to leave you with some considerations for how we can be preparing ourselves in the near term. And so to help us do that today, we have a panel of Open members and advisors from across the network's blades. And I'm really excited to be joined by Libby, Mullin, and Patrick Willard, both of whom have a long history of oral health advocacy at the congressional level. Melissa Burroughs, who's the oral health campaign manager at Families USA. Erik Skinner, who is a policy associate at the National Conference of State Legislatures. Layal Rabat, who's the program director at Asian Pacific Community in Action based in Phoenix, Arizona, and Zaida Dedolph, who's the director of health policy at Children's Action Alliance, also based in Phoenix. So I have some questions for our panelists to get us started, and hopefully we'll have time for a couple of questions for you all at the end. So I want to start with Libby. While we can't know everything that's coming down the pike, especially while we're in the pre-election phase, I think we do know that there's going to be a lot of immediate momentum starting in early November. And, whether that be presidential transition teams and congressional committee staff developing their first 100 days agendas, or the education of newly elected officials by a whole host of interest groups. So Libby, how can the oral health community navigate that landscape, and what conversations should we be having over the next 3 months?
Thanks, Casey. And I just want to thank everyone joining this afternoon after a couple long days and it being a Friday afternoon, the stamina to stay engaged and interested in advocacy at a time where, if anything, Washington feels like utter paralysis and disaster is, hats off to you, because we really need your voices on the front lines. And there's a lot of different talent on this panel today that are going to give you insights into how to execute that. But we have to get over this incredible uncertainty that we all feel, whether it is the continued surges that we're navigating in our respective communities with respect to the pandemic, or the lack of decision making on the congressional side in terms of the next COVID relief package. and of course, the election, which by no means are we going to have total clarity. Although we're debating internally in my house whether we'll really know something, at 2 a.m. on November 4th. But there is a lot we do know. The truth of the matter is that there are 35 Senate seats up for re-election there, which means that we, have there's 23 Republicans, 12 Democrats, but really there are only 6 in play. And that leaves 94 Senate seats that with relationships that are really important for us to pursue and maintain. Of course, every House seat is up, and I'm not going to go through each of those elections, but we may not know the committee breakdown and structure. The Georgia election may not really get settled until January. But as Casey alluded, this is a really critical time to either further relationships that you've begun over the last couple of years, or certainly introduce yourself to newly elected officials. The truth is the next 12 days is an excellent time to start that process. And if you have not already, with candidates that are, certainly looking strong and competitive in your, respective states. So the truth is that nothing is going to happen in the first 100 days that's oral health specific. That's not going to be shocking to you. We will have a big infrastructure bill, I think, if Biden wins, and that infrastructure bill will have a huge health piece to it. It is incumbent upon us as an oral health community to ensure that oral health is a part of all of these conversations, whether they are about the economic stability of our country and our health/dental health workforce, or as we prime the pump for health reform that is inevitable in a Democratic administration. Now, clearly the November 10th ACA court case will overlay all of that work. But, and I don't want to take up too much time because we have other panelists here to go through that, but I think it's going to be very important that open, weave the decision in that case into our strategic thinking, in terms of stabilizing coverage gains that we've made over the last couple decades as we look to expand coverage. But nothing that we do as a community can be done in a silo. It's never been smart for us to do that historically. It's even more important that we move beyond the silo and we build partnerships across the health sector, across players in the economic world, the business world, because it is absolutely instrumental to our success. So Casey, I'm going to pause there to give everybody ample time, but obviously happy to double back and go deeper.
Excellent. Thanks, Libby, for that overview of some of the possibilities of what might be coming down the pike on the federal level. And I appreciate that you mentioned partnerships. And so I want to ask Patrick, building on what Libby said and also what open members have already begun to do with the Day of Action earlier this year, what opportunities do we have for engagement with policymakers and their staff? And what steps should we be taking right now to prepare ourselves and our partners?
So right off the bat, we have less than 2 weeks to go until the election. So there's still time for groups to take advantage of the Ready, Set, Vote, make sure that people have plans for what they're going to be doing on election day itself, and think about how to make sure that people can vote safely and put that out there as sort of a bipartisan effort to make sure that we're in the game. Use the hashtag oral health votes for your tweets around the election day. Then, as Libby was mentioning, there are 35 races up in the Senate side. That means there are 65 senators who are going to be coming back. You can reach out right now and try to set up some meetings for the post-election time period, to talk to members and their staffs, to talk to senators and their staffs. In fact, every state has at least one senator who's going to be coming back next time, except for Georgia, where you've got 2 races. And there are some big winners out there. In New York, you've got both Senate seats. In Pennsylvania, you got both Senate seats. Ohio, Indiana, Florida, Nevada, Washington State, Hawaii, and California. Of course, one of those senators might be doing something else in California once we get past this election. So those are big winners, and you should reach out right now and try to set up a meeting post-election to talk about what the next Congress is going to be like, what can be happening in the next Senate. Also, you can put together letters right now that would go out to the prospective winners so that you can use that as soon as the election's over to start setting up those meetings. That's what this post-election period is about, sitting down, meeting with these people before they get into the 2021 Congress and really getting a chance to leverage some of your work with community partners, whether it's with medical groups or with AARP or other groups that you can go and meet with staffs and talk about the important healthcare issues that are going to be coming up in 2021.
Great. Thank you, Patrick. I really appreciate the motivation behind this messaging that we don't have to wait until Election Day or after to start mobilizing. So thank you for that. And, you know, in addition to the engagement that we've been talking about at the federal level, there are also a lot of opportunities for movement at the state and local levels, which I think everyone here knows, as well as opportunities for state and local groups to offer their expertise on setting a national agenda that's really grounded in the needs of local communities. And so for Layal and Zaida, you both work closely on oral health advocacy with a network of partners at the state and community levels. And so I have a couple of questions for you both, and I'll start with Layal. So as someone with a lot of experience with grassroots organizing, how can we ensure that the voices of affected communities don't get lost amidst our advocacy agendas and that their needs get centered in the policies we advance?
So the work that I've been doing, we've done that in a variety of ways. And so what I've done is engaging community members through a variety of different types of workshops, art shows, open mics, and other strategies that really help us connect personal experiences to systemic ones. We've also done a lot of advocacy education and brought community partners together to learn from each other. Because my biggest challenge is to engage communities in oral health policy in a relatable way, in a tangible way. So, you know, in some ways, my involvement in Open and in my state coalition removes me from the grassroots experience a little bit. And so, you know, the more that I learn about policies, the less aware I become of what information my community doesn't have, because, you know, you tend to assume everybody knows what you know, and that kind of removes you from that experience. And so for accountability, I have a really small coalition of community partners that I work with. I also work a lot with my state oral health coalition. And, you know, my goal is to ensure that when I'm talking about my community, that I'm really amplifying the voices, and I'm acknowledging that I only speak for myself. I don't speak for the whole community. So it's really about creating ways that community partners can hold me accountable. And, you know, so when we're working together to identify policy priorities, I'm not saying, hey, these are the policy priorities, this is what you have to do. But what I'm saying is, this is what the political environment looks like, this is what the policy environment looks like, and what are the community's concerns, and how can we connect both of those things. And so that's kind of how we ended up working on reproductive justice and its connection to oral health and to trauma this year. I also seek opportunities for my coalition partners to become directly involved in the policy work. I invest in their participation through the use of mini grants and by connecting them directly to the work. And I'm always looking for opportunities. You know, what tables am I sitting at, and what are ways that I can create space for more community members to get involved if they have the time. And so those are kinds of the ways that, you know, I've done, the things that I've done to help ensure that the community voice stays consistent and is amplified through this work that I'm doing.
Thanks so much, Layal. I'm hearing a piece about sort of feedback loops and those bidirectional forms of communication. So I appreciate that. And relatedly, Zaida, you know, as we move toward the year ahead, I'm wondering about your thoughts on how advocates specifically can take what they've heard in their communities, as Layal just described, and elevate the profile of oral health in their states.
Sure. So one of the things that we're really working to do is close some of the coverage gaps that we're seeing and the oral health disparities that we're seeing, particularly for American Indian and Latinx community members in Arizona. And we really view community input as very critical to that. So we host a number of different listening sessions. Oral health comes up in every single one of them. We do not have a Medicaid adult dental benefit, and we have some pretty significant barriers to access for those that are covered. So children in our state still experience pretty big barriers. So just to provide kind of an example of one of the things that we've done recently, we have heard from community members that they weren't able to access dental care where they were. And so what we did is we commissioned an independent study into our Medicaid agency's network adequacy. They basically did a secret shopper call. They called every dental practice who's enrolled with Medicaid in the state and that serves children. And they measured how long it would take to get an appointment and kind of their response to the question of, you know, I have Medicaid, can I come in and get my service here? So they did find a small difference between the wait times for patients on Medicaid versus with private insurance. They did a simulation of both types of insurance. But more importantly, what they did was they went into the directories for each of the managed care organizations in our state, and they found every single provider and mapped them out by zip code. And what they found is that there are actually 4 entire counties in Arizona that don't have access to a single pediatric dental provider who is contracted with Medicaid. And that's really important because the 4 counties that we're talking about are, you know, when we look at the data that is quantitative, they're majority minority counties. So high proportions of American Indian and Latino families, very low income, disproportionately, I would say, likely to qualify for Medicaid or CHIP. And so having to travel 80 miles to get to the nearest pediatric dental provider is a huge burden, and it's clear that, you know, this is a disparity that is targeted towards certain populations and in certain areas of our state. So part of what we're doing is we're working with a Navajo-owned and run branding and marketing agency to identify from the individual perspective what can and should be done to remedy those disparities. So some of it is as simple as a very different cultural understanding of what healthcare means in American Indian communities. And some of it is about, you know, just not being able to access that care because it's 80 miles away through the desert. So we've, from that, begun to start kind of a series of focus groups. And the goal of that is really not just to treat data from individuals' experiences as what it is, which is data, but to find ways to translate that, that information that we're getting from individuals and families into something that we can take to our Medicaid agency and have them understand. So I'm going to just pause there and see if there are any other questions or what we can do.
Yeah, thanks so much, Zaida. You know, so we've talked a bit about the federal level opportunities and also what folks are hearing in their communities, how you can sort of get that information and sort of funnel that up to state and federal level advocacy opportunities. And so, Erik, I'm curious from your perspective, come November, as many states are readying new legislatures, what should open members be doing to prepare themselves to educate and engage these new policymakers?
Great, thanks for the question, Casey. And for a little context here, we're anticipating having quite a few new members or new state legislators after the election. There are 6,000 legislative seats up for election, and we expect about 1,200 to 3,000 of those seats to change. So doing your research, starting a conversation, and building a relationship are really key. And we're actually working on planning something for the network in the next few weeks on this issue. So I work in the health program and cover oral health at the National Conference of State Legislatures, but in a few weeks, we'll have data, and I'll be sharing that data and the graphics from our elections team and cover the state-by-state results. NCSL is a bipartisan organization, and we don't advocate for any specific policies, but sharing this information with stakeholders like you all on ways to communicate and build relationships is something that we feel benefits the legislature as an institution. So, we're really excited about talking about this. One thing I'll say about state legislators is that they come from all walks of life, and odds are they are not an oral health expert. They often tell us that they feel like they're drinking out of a fire hose when they're trying to process a new policy area. And so just a way to say that new legislators may not have any experience at all in oral health. They could be sitting on 3 committees that don't relate to their pre-election profession, and they rely on people like you all for timely, accurate information on issues that are on oral health issues that are before their committees. So we'll, on this kind of piece that we're planning for the next few weeks, we'll get into the logistics of sitting down, probably virtually, but sitting down with state legislators and thinking about things like resources to share, having a truncated version of your ask or pitch ready to go, and kind of last minute changes and meeting with staff as opposed to legislators. So it's important to provide them with context. So what oral health issues has the legislature recently considered? What was the outcome? How do your priorities align with recent state oral health efforts? Is it more helpful to reach out to your representative, the chair of the health committee, or the legislative champion in your state? So we'll cover all those questions and more, and hope to leave you all feeling prepared and comfortable to build new relationships with and educate your state's elected officials on oral health issues. So thanks again, Casey, and we hope to see everyone at that webinar, but I'll hand it back to you unless there are any questions.
Yeah, thanks so much, Erik, and definitely keep your eyes open for an invite to the webinar. To round us out for this section, I want to ask Melissa, given what Erik just shared about the importance of oral health advocates educating and sharing context with their legislators, what issues are or should be top of mind for new state legislators or governors and their staff when it comes to oral health?
Sure, thanks so much, Casey. So as Erik just mentioned, oral health in and of itself probably won't be top of mind for new state legislators or new members of Congress for that matter following the election, but of course we think it should be. And so first, just on that point, I do want to reinforce what Libby was saying about moving beyond the silo and partnering with folks working on other issues that are related to ours and tying oral health into things that are top of mind, because some of the things that will be top of mind for state legislators are things like the state budget process and the state budget hole that's likely still going to be a problem when we get into the new year, as it has been all this past pandemic time. And so I think that's really going to shape the budget is really going to shape the oral health opportunities that we're seeing at the state level. Certainly Medicaid adult dental will be something that'll continue to be a tricky issue to manage during tight budgets. There will be some protections in place, at least, up until the new year with the maintenance of effort that's in current law. And that may continue into next year, but certainly we'll need to watch things like reimbursement rates or specific programs in your state for things like school-based care, or, if your state has like a specific dental program for the elderly or something that's more sort of a direct special program that isn't necessarily protected by the maintenance of effort. So the budget cuts are something that we definitely want to be watching and understanding, and helping our legislators understand why oral health is something that shouldn't be cut and actually is counterproductive to do in the pandemic environment. The other thing that'll be top of mind for state legislators, I think, will be related to that, is sort of what's happening at the federal level with COVID relief and what money is going to be made available to state level policymakers and state governments, and also to local governments. So that's just another thing to keep in mind, is there's real connections between what's happening at the state level and the federal level. Other things that are likely to be ongoing opportunities at the state level are issues related to oral health workforce, scope of practice, data, measurement, studies, things like that, those sorts of things don't necessarily have as big a price tag as some of the coverage issues we work on. So those are things that are, likely to be useful areas to keep pushing. And then finally, I'll just say, thinking about the connection to federal action again, whatever happens with the election, things that we know are coming down the pike are something will happen with the healthcare appeal lawsuit, which will determine sort of the future of the ACA, and that will have real implications for state level health policy and oral health policy. And there may very well be some kind of big healthcare reforms coming from the federal level as well that, again, would have implications for how state level policy plays out. So I think those are things are coming a little bit further down the road, but as they happen, it'll be up to us to make sure that oral health is part of what state policymakers are thinking about as they react to those federal developments.
Thanks so much, Melissa. I'm looking at the time, and it seems like we do have a couple of minutes for some questions. So folks can start putting those in the chat box. If you send them to everyone, I think I should be able to see them. I may need some help from the open folks if some questions come in on the back end. So while folks are thinking and starting to put their questions, I just want to thank all of our panelists. I feel like we really packed a punch with all this great information in a pretty short amount of time. So I appreciate you all taking the time to share your expertise and tips with us. As a spoiler, I'll say we do have a very brief, just one question poll for the participants that we can do after the Q&A session, just to get a feel from you all about what issues you think you'll be focusing on in the coming year. But in the meantime, if folks have questions for our panelists, we're happy to facilitate that.
Thanks so much. The chat box should be working still. So we have a question. Can you remind us what is the best? Oh, chat box just disappeared. Hold on. Come back.
I got it, Stacy. Can you remind us what is the best way for members to stay up to date on further developments and upcoming advocacy opportunities? I think that's a plug.
I think that's likely a plug for the policy NRT, and we have several folks on the panel who are members of that group. So there are monthly policy NRT meetings. I think folks are welcome to join those. The Take 20s with the network, where there's a lot of federal policy information shared, I think are also a great way. The webinar that Erik mentioned that'll happen post-election. Folks have other things to add that I missed?
Well, we will be having the November 10th, we will be having the post-election webinar, which will be looking at the results. And so people should be aware of that on November 10th. It's the day of the Supreme Court's going to be hearing about the ACA, and also the day that we're going to be talking about the results in the election. So look for that. It should be 2 o'clock Eastern time on the 10th.
Yeah. And I would just add that I think as things unfold and we achieve more clarity about committee assignments and at the federal level, we will have an update for the network, and some of those decisions could very likely lead into January. But I think as committees of jurisdiction play out, we will definitely want to keep you guys fully abreast of that.
Thanks, Libby. If anyone is interested in joining the policy NRT, please reach out to me, Stacy Chazen, and I'm happy to add you to that. We have another question. Diamante driver's death led to a lot of policy change. Is anyone coordinating collection of stories to speak to the assumed increase of morbidity and mortality from oral diseases?
I can speak a little bit to that. We aren't doing something that specific, but Families USA does have a story collection and storytelling effort. And I'll put the link in the chat where we have an online story collection form that we would love for folks to share with their networks. But it certainly is a way in which we hear about stories that consumers and people in our communities are experiencing, and if there are other places that stories are being collected and shared and cataloged, we'd be more than happy to coordinate.
Thanks, Melissa, and we'll include that link in the post-meeting materials as well.
Yeah, myself and my partners have also done some story collecting and story sharing here in Arizona through the format of doing it in an open mic session where we all have an event, and bring food and music and things like that. And people sit together and they talk about their experiences in accessing oral health care. We had a couple of people that dealt with oral health access issues during their pregnancy that shared, which helped inspire some of the work that we're doing right now. And so I'm always happy to talk more about how we did that if you want to email me.
Thanks, Layal. Another question that came in, what are some, and this is for any of the panel members, what are some of the issues outside of oral health that will likely be prioritized by lawmakers, and how can we connect those issues to oral health? So it's a great question, Camilo.
I'm happy to start, but I know that the other panelists will also have perspective on this. You know, there's going to just have to be a huge push on another COVID package for whether, and we'll probably see something in the lame duck. And that's not something that we should ignore, because there may be opportunities in that package, although I think it's pretty much baked. But in the first 100 days, certainly if there's a new administration, we're going to see a very heavy push on infrastructure, which includes, you know, the commitment of 100,000 new public health officials, which at this time, there has been no explicit inclusion of oral health being a part of that army of officials. So I think it's really important that we proactively, you know, connect the dots that good oral health is also very important for economic well-being. And there's some data, really interesting data around employability and other facts. But of course, the delayed care that we just referenced that has occurred during the pandemic also has a huge downstream effect on everything from education to employability. So there is almost every debate going on. There is a way for us to connect those dots back to oral health without being, you know, too creative. I mean, it's pretty obvious. So I'll leave it at that, but I don't know if Patrick or Melissa have something to add.
One other thing that I would mention is Medicare is, there has been concerns about the Medicare Trust Fund, and whoever wins in terms of the presidency, that's likely to be something that Congress is going to want to pay attention to. If Biden wins, there are also additional changes around Medicare that have been proposed as part of his healthcare plan. So I think that knowing that there's congressional interest in Medicare is a way for us to take that opportunity to raise the fact that dental, hearing, and vision are all excluded from Medicare right now and could be included. So Medicare is one area that I think to pay attention to going forward.
Great, thank you. We have another question. In Hawaii, we would like to introduce a bill to reinstate adult Medicaid benefits. Do you have any recommendations on how to approach this issue during this time of COVID-19?
I don't know if Erik wanted to talk about something. The good news is that there are some state model plans on how they've pursued this. Obviously, you know, what Melissa mentioned, budget is huge. And so you've got to make your ROI case. Every time we're looking to add benefits, we have to be able to articulate that the modest investment in those coverage dollars pay dividends. And there's some really compelling data around this when it comes to Medicaid and obviously the cost of untreated care. But I think when you design the actual benefit, it's important to look at some of the states and how they've done that, because there's some that have obviously handled it much better. And the other thing to keep in mind would be that it doesn't, you know, if you're failing across the board on adult dental and Medicaid, it does seem to be more broad-based agreement on pregnant women in Medicaid. So it's sort of like you have to keep all the different options in your cap as you pursue what is really a critical piece of this safety net.
Yeah,
I'll just jump.
Oh, go ahead. Sorry, go ahead.
Oh, no.
I'll just add, you know, I think everything Libby said is correct, but you know, the thing that's interesting is even with this challenging budget environment, we did see some progress in state legislatures this year. And I'll share sort of Families USA's summary of what happened in state legislatures on this year, and the Medicaid Adult Dental Benefit Learning Collaborative, which I know you're a part of in Hawaii, is another good place to kind of flesh out some of these experiences that these other states have had. Sorry, go ahead, Erik.
Thanks, Melissa. Yeah, just echoing what everyone said. I can't really get in on the, what should be done or how you move the policy forward, just knowing that this is something that's on the minds of our members. We touched on budget, which is a huge part of it. The budget reductions and the projections do not look good. So it's just something to, just context to be aware of. And definitely look, there has been states have made progress on the legislative side on oral health this year, but it's kind of a mixed bag. We did see recently a state, unfortunately, a legislator, we know he enacted legislation to expand the oral health Medicaid benefit for adults. And recently he had to introduce a bill to repeal his own expansion of that program. So it was in the last few months, and we believe that that's related to negative budget projections. So just a reminder that this process could already be underway from a budgetary perspective in some states.
Any other questions, Carrie? We don't have any others in the Zoom chat. I don't know if you're seeing anything else in Pathable.
I'm having a problem. Sorry, there's a little issue getting off mute. So thanks, Stacey. I don't see any other questions. Just to want to highlight some resources that we're continuing to share via the chat. So if you're newer to the network, you may not know that one of our senior analysts, Patrick Finnerty, actually created a congressional engagement matrix, which is a very robust spreadsheet which lists the sort of contact information for all of Congress members and some of their staff. We've added that link in the chat. In addition, there was some communication about a recent bill that's being identified to increase the addressing social determinants of health. So that bill is actually, it's called the Improving Social Determinants of Health Act of 2020. That is available for signature and sign on. And I will add that link to the chat. We do have a question coming in. How do we make oral health essential in the eyes of our medical colleagues? So not sure that that's a policy question, but wondering if anyone has a take on that.
And then I'll say we have about 1 more minute, and then we're going to turn to our poll before we wrap up.
Well, I'll just take that last question because I actually think every conversation, whether it's with medical colleagues or policymakers, has to begin and end there. And the only way we were successful in achieving oral health coverage for children in CHIP and making it a part of the essential benefits in the ACA was linking our efforts centrally with the pediatric community writ large from a provider base. In fact, AAP was an incredibly important partner. And we know, which is the consequences of untreated disease and what it does across the body. And so the clinical connection is really important, not just with our medical colleagues, but with our policymakers. And, I just think you have to do the due diligence to explain the infectious nature of the disease and the progressive nature. And it's just not intuitive. Most people think, oh, well, my mouth is clean, I don't have cavities, and so I'm good. But so that we have learned the hard way after 19 years of doing this work, that I often have to begin and end in the middle of every conversation, remind people that this is an infectious, progressive disease and moves through the body. So I would keep that in mind.
Thank you. So Casey, I'm going to turn it back to you to introduce our poll, and then our friends at NPHI will give the audience instructions on how to complete it.
Excellent. Thanks, Stacey, and thanks again to all of our panelists. So as I said, we just have a very quick poll. It's one question. We just really want to get a read from members of the network about what you all think you may be working on in the coming year or so. And so, you see the question here, what issues do you think you'll be focusing on in a new Congress with the possibility of a new presidential administration or with new state level policymakers in office? It will be multiple choice. So I'll turn it over to the folks at Open to explain how the polling feature works. And you'll see a number of options and you should be able to check all that apply for you.
Thank you so much, Casey, and thank you to all the panelists today. This has been quite insightful. So for everyone who is in the Zoom app, you'll need to minimize your screen and go back to Pathable. As on the second tab, right next to chat, there are the poll questions. For anyone who's just viewing the webinar through Pathable, then you just need to click on the second tab that says poll. So I'm going to do a really quick screen share just to show everyone exactly what I'm talking about. But again, if you are watching the webinar through the overall Zoom platform, you will need to minimize your screen. And what you want to do is click on polls, and then you'll be able to answer the polls there. For anyone who is in Pathable already, and it's going to look a little different just because of how I'm watching the webinar as well, then you'll click on the second link, second tab that says polls, and you'll be able to respond there. So again, if you're in Zoom and you're watching the webinar full screen in Zoom, just minimize your screen, go back to Pathable within the actual session, click on the second tab that says polls. If you are watching it within Pathable and it looks similar to what I like to say, a YouTube page embedded into the actual page, then all you'll need to do is again, click on the second tab that says polls. And while we're talking about just the different tabs, I do want to let you know there are some files available as well. So please make sure you download those files and resources, and we'll make sure to upload the additional resources as well within Pathable too. So I'm going to stop sharing my screen and I'm going to turn it back over to Josh, who's going to show some of the results. So thank you all so much for being here.
Let's just give a little more time for a couple more people to vote.
I'm going to share my screen again just to assist with anyone who cannot find the poll. So I'm going to share my screen. And so if you're in the session, so even if I go back to the main, if you happen to exit out of the agenda, if you click on the session, you open up the session, you'll see the chat feature right here. What you want to do is click on polls, and that is the second tab. So if you're in the Zoom webinar overall, you want to minimize your screen. If you are in the Pathable app, what you want to do is just click on the second tab that says polls. You'll click on vote. So, and this is where all of the polls are. So you'll be able to select your answer. So again, I'm going to cancel that. So once you get on polls, it's the second tab. You have to click on vote, and that's where all of the different answers comes in. I am not going to submit my answer right now because I don't want it to time me out. But if you are in Zoom, you do minimize your screen and you go back to the and click on the polls. And if you are in the Zoom, if you're in Pathable, again, you're going to click on the second tab and you'll select vote, and that's where all of the responses come in. So I'm going to stop sharing my screen. I'm going to turn it back over to Josh just to review some of the answers. So thank you all so much.
So thank you all for taking the opportunity to vote. I know the policy NRT and the panelists that we've had shared today will certainly continue to look at this information. Casey, did you or anyone else on the panel want to add anything as we move to the next piece of our program?
No, just thank you again for taking the time to do this. I think the policy NRT will probably follow up. I think there was a Medicare option in there that didn't quite make the cut, but it is on our radar. So if you're working on that, you can let us know, or we can find another way to connect with you. So thanks all.
I think there's one more slide for you. Want to share? Drum roll. There's a really cool thing happening. There you go. Does anyone want to say, so just to know that we have identified a date for our first ever Open Policy Summit. So mark your calendars now for February 10th through 11th of next year. More details and information to come. Again, if you're interested in getting more involved with the Policy NRT, you can do two things. One, you can reach out to any of this Open Inc. staff through our general email account, which is info@openoralhealth.org. You also can reach out to us via the open communities and get involved with the Policy NRT that way. Thank you all so much for your time. We really appreciate it. It is now my pleasure to move us to a powerful close. And you know, this is sort of our favorite time. We actually, you know, get the opportunity to stand up and make commitments. And I hope that what we've put together this year in the virtual space has really delivered on our intention. One was to really provide some skill building and opportunity to look at the oral health system and also celebrate the accomplishments and progress to date, and to start developing our goals and strategies for the next 3 to 5 years. The second piece was to ensure that you were updated on what's been happening with Open and Open Inc. and all the things that have been happening and transpiring through the transition, as well as just an opportunity to connect with one another. And then finally, we really want to re-inspire or continue to emphasize our commitment to race and race equity. And so in that vein, it is my pleasure to bring up some of our regional oral health connection team leads who will close us out with some really powerful call to actions. Next slide, please, Josh.
Okay, well, this is me, I think. Hello, everyone. My name is Katie Andrew. I'm a Senior Associate of Oral Health at Children Now in California, and also a ROC lead. Thank you, Carrie, for that introduction. We just want to quickly share this quote with you. President Obama said, "Democracy works, but you gotta want it, not just during an election year, but all the days in between." I suspect that no matter your politics, like me, you understand the beauty and fragility of democracy as never before. In just 11 short days, we have the opportunity to participate in our democracy's most valuable franchise, which is to vote. Participation in the electoral process is power. Voting is power. It matters. Don't let your power be discounted. Get out there and vote. Make a voting plan. Help your friends and family make a voting plan. Let's get out the vote like our democracy depends on it, because it does.
Hi, my name is Tanya Dorf-Bruner, and I'm in the Midwest ROC team. I'm one of the ROC leaders in the Midwest. Many of us are waking up to the history we did not understand or were not taught. I'm from Topeka, Kansas, home of the famous Brown versus Board of Education Supreme Court case. We're very proud in our community to be associated with the Supreme Court case that determined that separate is not equal. And you may not know, but Kansas also fought very hard to enter the Union at the beginning of the Civil War as a free state. We take pride in this as our heritage in our state. But it's not all good. This week, literally this week, we learned that the namesake for one of the school districts in my county was the leader of the local KKK in the 1920s. In this Midwestern state, we don't have statues and monuments that we need to reanalyze, but now we do have an entire school district we have to reevaluate. So our community is soon going to be wrestling with the need to take the anti-racist step and rename an entire school district. Student journalists were the ones who reported the story, which I find to be pretty remarkable. When they reported it, they said, "I think a lot of us regard him as some sort of kind founder of our school, and now we don't know the motives for why he would have created the school, or what actions he took throughout the district that may be still affecting us now, that maybe we need to reevaluate." So I'd say, let's take a page from these student journalists, because it is time to learn from the history, acknowledge the past, and take action to create a better future here in Topeka, Kansas, and in every community across this country.
I love your mask, Tanya. I'm Bobby Muto from West Virginia, and I am one of the Northeast Region Mid-Atlantic leads. And when I first got this quote, I was kind of thrown back, but many of you may remember the actions rather than the name of Julia Butterfly Hill. She spent 738 days living in a 180-foot tall California redwood to prevent the Pacific Lumber Company from cutting it down. And when I first got this assignment, when Carrie shared it and I read it, I thought, how? Like, I can't do anything for that long. And then it hit hard. I am doing something that long and that hard. But when she was up in that tree, she was surrounded on the ground by people that were giving her food, supplies, survival tips, and most of all, inspiration. So just like Julia Butterfly Hill, I'm here with all of you today that I get my inspirations from, I get my passion from, I get those tools, those ideas, those solutions that she talked about. And that's what keeps me up in that tree. And I'm in that tree looking out at a future with an equitable health care system. And between here and there, we're going to have many opportunities for change. And we are going to be those solutions. And it's going to start with all of us. We really all need to keep those opportunities in front of us, and don't be afraid to take them on, because you are surrounded by all those people on the ground that are going to be sending up food, sending up inspiration and that passion. And just to go back to Kate, I voted this morning with my 93-year-old godmother who actually came here from Germany many, many years ago to escape the horrors that were going on there. So we did you proud today. So with that, I'm going to pass it on.
Hi, everyone. I'm Annalise Cothran, the Executive Director of AIDPH, and I am a lead for the Southeast region, along with Beth Stewart and Mahek Kalra. The late John Lewis inspired us with his radical commitment to justice, encouraging us to, quote, get in good trouble, necessary trouble, and redeem the soul of America. He said, history tells us that we must never give up, that we must never, ever give in or give out, that we must not get lost in a sea of despair, that we must all keep the faith, and that we must keep our eyes on the prize. Over the last decade, we have built Open, a powerful network that can raise its collective voice on behalf of those most marginalized and demand a more equitable and just oral health system be created. We absolutely must keep our eyes on the prize until we have succeeded in ensuring that oral health is affordable and accessible to all. Speak up, speak out, get in the way, and keep making good trouble, Open members.
Thank you so very much to all of our ROC leads who have shared what I believe to be incredible, inspirational and personal takes on what is needed from us at this moment. We so appreciate you being a part of the network, for you engaging with us over these past 3.5 days, including our pre-conference, and really just sort of being a part of the momentum. We certainly apologize that we can't be in person, but you can imagine me running around the room, making you do the wave as we wrap up. So as we turn to close, I want to thank each of you individually and collectively for what you do and who you are as part of the network. We've got a couple really cool things to do, so if you'll stay plugged in for just a few more minutes for us, I'd appreciate it. Immediately following our formal presentation, which will end at approximately 3 o'clock if I'm talking fast enough Eastern time, you will have the opportunity to engage in post-conference network sessions. So imagine yourself grabbing your brown bag lunch from downstairs or across the hall and sitting down, if you will, in a virtual setting with some of your network members. With that, I want to share a couple of final thoughts around what we have going on, asking you to say the date for